Just need to catch my breath.
Oh my gosh. Interpretive dance gone wrong. What in the Pulp Fiction and Freeze Your Peak? Get ready to laugh because today we're breaking down and reacting to all of the absurd medical scenes and harebrained injuries from American Dad. Let's dive right in.
Chivalric Cabaret.
Oh, small hematoma to his forehead. That big bump, it'll turn into a bruise. Forehead has lots of blood vessels there, so they can pop underneath the tissue and swell up. Ouch.
Just need to catch my breath.
Oh my gosh. His vertebrae just came right out of his mouth. It doesn't work that way. If you have a high cervical fracture of the neck that injures the spinal cord, the likelihood that you would be able to move your arms and be breathing on your own is pretty low. Oh, don't do that. Don't do that. The grinding of the teeth. Oh my gosh. We have patients that come into the hospital that have ground their teeth so badly that there are no more ridges to the teeth. It is purely flat. It's like nails on the chalkboard.
Oh, honey, you're breaking out in a stress rash.
Anxiety, stress have a lot of different reactions to the body. The most common type of rash that we see when somebody is stressed out is more like the red blotching or the hives that individuals can get. You can literally manifest a lot of different physical issues relating to anxiety and stress, so something to be aware of.
You need ein facial. I'll call my Ling and make you an appointment.
Ein facial.
McCullough's Outdoor Furniture, Bob speaking.
Oh, I'm sorry. I must have misdialed. Click.
Treating stress and anxiety, lots of different ways to go about it. There's cognitive therapy, different types of meditation, breathing techniques. There are prescription medications that you can use, such as SSRIs or other classes of different medications relating to anxiety and depression. If you guys are interested, check out my brand, Life Happens. There's a supplement called Chillax that would be great to be used in such situations.
What you doing on my corner?
Hola, Taco King. Como estas?
I don't know if you guys know or not, but I know a lot of medical Spanish because a lot of the patients that I see speak Spanish.
You're cutting into my business.
Oh, come on. I bet if you let me inside your hard shell, I'd find a lump of soft meat.
No, we're not going there. Oh,
please, let's
jeez.
talk this out.
We see people who come into the emergency department relating to regular fights, trauma, injuries. Most of the time, it's all superficial things. We will make sure that there's no broken bones. If there is, we will reset them. A lot of times when bones fracture, they bruise a lot because there's blood that actually runs in the middle of these bones. A lot of wounds, you got a black eye. It's hard to know, is that the lower eyelid that is black and blue? Sometimes people can actually get blood within the eye itself, in the anterior chamber where it pools near your pupil. And you actually have to be really careful because it increases the risk of glaucoma.
I got beat up by a taco.
And he's got all these wounds and abrasions all over his body. If somebody came to the emergency department, we would just double check, palpate all these areas and see if there's anything that we need to get x-rays of. Typically, we give different medications relating to pain versus muscle relaxers, and then always ask the patient to follow up. Stress so bad that you snapped your own tooth. People will come to the emergency department with fractured teeth. There's not much for us to do. We need to see a dentist or an oral surgeon. Luckily, most dentists have emergency care like the next day. Say a tooth comes out and time is of the essence, so you can actually put the tooth back in if you have it. Freeze your peak. Interesting.
Interesting.
Like I said to the tech, I don't want to do anything crazy. Just
Freeze the peak? You came to the right place. Look what I can do.
damn, son.
There are lots of at-home skin therapy, rejuvenation, youthful-looking techniques or treatments that you can do at your house. Do any of you use them? Rollers, microneedling, different types of creams or elixirs? Let me know in the comments.
Maybe a tiny bit of Botox to freshen up instead.
Of course. Let's start small.
What do people use Botox for? Most people know this. It's to help relax wrinkles. So it relaxes wherever the Botox is injected. It's actually from botulinum neurotoxin. So it just has to do with the paralyzation, basically, of certain muscles.
This is the needle I use for heart paralysis.
Ah!
I'm a bad guy.
Oh, that's Honest, at least.
Okay, so heart paralysis. So paralysis meaning not moving, so you're killing somebody. We do use a medication in the hospital to pause your heart when you're in abnormal heart rhythms. It's called adenosine. It literally will pause your heart for anywhere between like 2 to 5 seconds. Oh, well, it only paralyzed them for a short period of time.
It's only partial paralysis.
Hopefully it was only a few seconds. Oh geez, that is a saw. Typically you'd use that to cut bone.
Hello, Stan.
Is it a full facial bandage? Typically we don't do that. Never done that in the emergency department. Maybe in a plastic surgeon's office would that occur, but we typically just treat very specific areas.
Don't worry, you're gonna love your new face. Although your old one is pretty nice too.
You can do different types of facial reconstruction, potential transplants. You just have to make sure that there's no graft versus host rejection. Whoa!
Oh my God, this is crazy!
Typically, you don't want to do too much plastic surgery, reconstructive surgery, unless it's definitely required.
Your wife has been suffering from an increasingly frequent number of semi-psychotic episodes. Mr. Smith, in layman's terms, you seem to be Francine's trigger. Even mentions of your name send her into a literal state of hysteria.
These are all like old terms that they use: hysteria, psychotic breaks. We typically don't say those things or use those terms anymore. You might say somebody's having psychosis. It's just a generalized term because you don't know exactly what is going on.
You have my wife, and I demand that you release her now!
I don't know if everybody noticed the flowers had a bucket of chicken in it. Patients are snuck food into the hospital by families all the time. In the emergency department, we typically don't want people eating because typically you're there for an emergency and God forbid you need to have surgery.
Try to understand. It could be months before she's well enough to re-engage with society.
I refuse to accept that!
The human mind heals itself at its own pace.
No!
There are different medications that you can use to calm somebody down, which that is in hopes to get the body and the mind to kind of reconnect to each other and refocus versus just this continued altered state.
I have to come up with some way to break you out of the hospital. Whoopsie doodles! I'm a nutso!
Trying to fake people out to get into the medical facility or the psychiatric hospital isn't very easy to do. You have to get evaluated by a psychiatrist after you're medically cleared, and then they deem is it necessary or not for somebody to have inpatient therapy versus outpatient therapy.
If you wanted to come in here, you could have just admitted yourself. You didn't have to dry hump our mailbox.
Yes, it's easier to have a voluntary patient go into an inpatient psychiatric facility, but there needs to be a reason why. And typically it's due to acute psychosis that somebody is unsafe to themselves or others. Who doesn't like American Dad? Stan, Roger, the family. It does give us some examples of how things would actually be handled in the emergency department and what to do. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.